Hello and welcome everybody to the Pacific region launch of the Global Roadmap for Healthcare Decarbonisation. It's fantastic to have you all here joining us. My name's Carol Beanie and I work for the Climate and Health Alliance, managing our sustainable healthcare program and coordinating the Global Green and Healthy Hospitals network here in the Pacific region. And I'll be facilitating this session today. I'd like to start by acknowledging the traditional owners of the lands that we're all calling in from today. I'm calling in from the lands of the Wurundjeri people of the Kulin Nation, and I'd like to pay my respects to their elders past and present and acknowledge that their sovereignty of this land was never ceded. So thanks for joining us today. We're really excited to be launching this roadmap, which is being produced by Healthcare Without Harm, CAHA's strategic partner and affiliate, in collaboration with Arup. And the purpose of this webinar is to introduce you to the roadmap and its recommendations for how the health sector can reach zero emissions by 2050. And also share some examples of how the health sector in our region is already doing this work and demonstrating climate leadership by setting bold targets for climate action. So I'm thrilled to be introducing you to our lineup of expert speakers in just a moment, and very grateful for their participation in this webinar today. But first, a few housekeeping items. You're all on mute and will remain on mute throughout the webinar. If you'd like to ask any questions, please put them in the Q&A function. If you'd like to make a comment, please put that in the chat function. We'll have some time at the end after each presenter has given their presentation to answer some questions. And I'll be sharing the slides that they each go through to everybody who's registered for this webinar afterwards. And I'll also be sharing a recording of this webinar with everybody who's registered in the coming weeks. So to kick things off, I'm delighted to welcome our first speaker, Sonia Roschnik from Healthcare Without Harm, to introduce us to the roadmap. So Sonia is one of the co-authors of this roadmap and works for Healthcare Without Harm as the International Climate Policy Director. Sonia has worked in the health and social care internationally for 30 years as a clinician, in senior hospital management and in sustainability. As International Climate Policy Director, she oversees work to support health systems around the world, including national and subnational governments, as they move to reduce their climate footprint toward net zero emissions and become resilient leaders in addressing the climate crisis. Prior to joining Healthcare Without Harm, Sonia served as the Director of the Sustainable Development Unit for England's National Health Service. And during her tenure leading the SDU, she launched the Greener NHS program, including a commitment to net zero climate emissions, positioning the NHS as the first national health system in the world to do so. She holds a master's degree in systems thinking and is a member of the Faculty of Public Health in the UK. Over to you, Sonia.
Well, thank you very much. And it's really wonderful to be joining you today. I'm calling in from the Alps in France. And so I'm calling on nature to help me with a presentation today. I'm delighted to be here, and you'll see that this is really a lot about systems and systems transformation. So just to get onto the roadmap, which is interesting because the slides are moving more slowly than I would have thought. It's really a navigational tool that is coming out at an extraordinary time. I mean, we've got the climate crisis that is accelerating. We can see that everywhere. I know in Australia, you've had lots of bushfires. There's been typhoons in the Philippines. We recognize now that it's a health crisis because of its impact on health. And we're also in another crisis, which is not unrelated to environmental issues, where, you know, so many countries and services are really struggling with how to respond to it. I know in Australia and New Zealand, you're leaps ahead of where we are in Europe, but we're in lockdown at the moment, and I'm only allowed to go 10 kilometers away. It's you know, there's quite a lot of stretched services around, but it also has an impact on equity, and that's been brought into real sharp focus through this, the differences between the world, between peoples in different countries. And of course, because we've been using so much more plastic, so many more different you know, protective equipment, it's had an impact on the environment as well. But having said that, you know, we have got so much that we know about prevention, equity, preparedness, and climate smart healthcare, that it's really an opportunity now to try and bring them all together into one. And that's our opportunity with this extraordinary time. So systems thinking is central to that, and it's all really about a transformation. And I think I might ask Remy to move the slides for me, just because it might move faster from your end in Australia. We started off with a climate footprint, which was done in 2019, and that set the size of the issue. So globally, emissions are 4.4%, and that's about the size of, if it was a country, about number 5 on that list. So it's pretty sizable, and we really now need to be moving into what we do about it. So this roadmap is really, if you'd like to move to the next slide, about how we do that and how we take it forward. And it's got 3 main findings. One is that the health sector must tackle the climate crisis, because it's an even greater threat than COVID. We need to achieve decarbonisation for a number of reasons, but we need to make sure that we utilize it as a means of addressing health equity and climate justice between nations. And that also means that the way developed nations take responsibility compared to low to middle income countries might take responsibility. There's differences there that we need to support and develop. And we need to make sure that the health sector itself is transforming so that it can contribute to this broader societal transformation. And I hope that all of that will come to light as we move forward. So if we can go to the next slide, that'd be grand. So we've published 68 country fact sheets, which gives a snapshot for each country. This is Australia's one, and it gives a sort of high level view from the data that we've got. I know that in Australia, you've done a lot of your own carbon footprinting, so you've got some more bottom-up data that needs to be utilized. It gives you a breakdown of where the emissions are in your country, and also what your bespoke trajectories would be according to this roadmap. So I'd encourage you to have a look. It will no doubt raise more questions than answers, but the idea is to try and highlight that different countries might be on different trajectories, and to encourage further action. So if we move on to the next slide, we've also got a lot of resources online. So I would encourage you, because what I'm going to give you today is just a snapshot, but there's a huge amount of resources from the main report to these country fact sheets, and also to some annexes, which are for those of you who want to understand more about how the roadmap was constructed, or some of the sort of interventions and actions that can be taken. They're all there. So if we move on to the next slide, this is really the projection of, if you start at that bottom dot, it's our 4.4%, and the projections across the globe is that we will triple our emissions by 2050, and that's if we don't do anything. The next, if you click again, that first wedge really describes the nationally determined contribution. So that's what every country has committed to reducing through their commitments. And it's, that would reduce the growth by 70%, but it's still going up. This maroon wedge that you see here is what we're going to be talking about mostly through the roadmap. It highlights the actions that we can take. And then there's another one, which is the uncharted territory, which is a yellow piece here, which highlights some further action that we could be taking if we wanted to deepen the decarbonisation. So I'll take you through those in more detail shortly. The one big finding really is that 84% of carbon emissions for the health sector are to do with fossil fuel combustion in one form or another. So be that through energy that's used, be that through products that are made and derived from fossil fuels, and the way it pertains through the broader economy. So that's quite a startling finding, and just a headline for you to be aware of as we go forward. So if we move on now to the next set of slides, I'm going to be describing to you what this really means, and what we've said about decarbonisation means that we really need to sort of paint a little bit of a picture as to what that might look like, so that this roadmap sets a vision and a strategy for going forward. And the way I sort of describe it really is that there's got to be you know, greener renewable energy everywhere, and that will include places, clinics maybe that don't have access to the grid in the same way, and so that they could be powered at night. But it might also include really thinking through all of the purchasing of products that we utilize, the medicines that we utilize. You'll see later that this becomes really important. It's also about making sure that buildings are zero carbon, and that we transform our models of care, because the reality is if we just keep doing things the way we're doing them now, we're never going to reach a zero carbon. We need to bring them down. And at the end of the day, everybody has got to play their part, whether you're a health professional that's prescribing medicines or choosing products in your daily sort of meanderings of work, whether you're a building engineer who's focused on making sure that we've got as much energy efficiency or renewables as possible, you know, or if you're a health decision maker who can really put in place the right kind of policies and financing to support that. But at the end of the day, we're all patients as well. So we're all concerned with the sustainability of healthcare. And from that perspective, we need to use our voice as patients as well as health professionals to try and advocate for what we want. I mean, I sometimes try and say, well, you know, do I, I'm going to have my first vaccine today. Do I ask how the waste is going to be utilized or managed? And I think the day patients start having a greater voice, we will see quicker change. Certainly in the NHS, it was one of the big barriers, as people said, well, patients aren't asking for it. So let's get into the heart of the roadmap. These trajectories highlight that really every country is starting at a different place. We've got, most countries have committed to some form of reduction, but we need to make sure that those that are highest emitters, you know, reduce the fastest. And these four trajectories highlight the different starting points. We recognize, of course, that some countries will need to grow their emissions because they haven't got universal access to healthcare sufficiently developed, and that there's an imperative to do that. And we'll there's a part of the report that highlights system effectiveness, which really describes that quite explicitly. So if we move to the next slide, please, I'll start describing to you the different pathways. This is the chart that you saw at the beginning, and I'm not going to be talking about the blue wedge because that's what we are hoping every country will make sure that they achieve. So we are talking about the maroon wedge here, and the first pathway, if you click on it, is really the pathway of all the things that healthcare itself can do to decarbonize. And so that will be through clinical practice, through the way facilities are run, through the way waste is segregated, for instance. The second pathway is around the supply chain, and that's purely the products in the supply chain that would obviously need to be net zero. So products that are being used by the health sector, the way we use gloves or the way we use products, we have got a lot of control over. And that's why the supply chain category looks a little bit smaller than the 70% that everybody's used to, because actually we can't just say that there's the 70% of scope 3 is supply chain. It's actually a shared responsibility. So the third one is really the piece that's around the decarbonisation in the wider economy and society. If all grids decarbonise, if the pace of change that happens in agriculture through all the infrastructure, transport, housing, take place at the same pace, that will really have an impact on the healthcare carbon footprint as well. And it's part of our responsibility to advocate for that as well. So I'm going to move on to the slides which highlight the 7 high impact actions. And these are just taking that same maroon wedge and cutting the pie in a slightly different way. And I'll try, they're all intertwined with those pathways, and I'll try and describe that a little bit more. So the first one, if we move on to the next slide, it will highlight the renewables chunk that could be, and that's really about the wider energy transition and making sure that communities everywhere in the world have sufficient access to renewable energy. The next chunk, which is the biggest, is around buildings, and it would contribute 17.8 gigatons. That's around the emissions that the US and China in 1 year might contribute. I chose those two countries because yesterday John Kerry was visiting China to try and see if they could come up with I guess some, as the two highest emitting countries, with some kind of agreement towards COP. So let's hope that that's very successful. So buildings is key. The next one is transport, that you can see there, which is a lot smaller. That's sustainable travel, but also electrification. You can see that food comes up. And the next one is around pharmaceuticals. And that's because every drug that we prescribe will have an impact here. So the prescribing of drugs, the green manufacture of medicines, and also the way we dispose of them and the way they're transported all have a big impact. Here we've only modeled inhalers and anesthetic gases because they are the hotspots, the ones that we're most aware of, and because we know there's clinically safe ways of doing a switch. But you know, that's likely to be the case through so many different medicines, and also we can do social prescribing. So the next wedge is really around how we can make sure that all the products we use are either designed for reuse, are reprocessable, or that we manage them in a very different way. I know in Europe we talk about the circular economy. I'm not sure whether that's a term that resonates with you, but it's this concept that we should not be wasting anything, and that we can reuse, reprocess, and make much, much better use of our resources. So that's quite key. And the last one is this system effectiveness piece that I've told you about, and it's recognizing that across the world, some countries invest an awful lot of money and don't necessarily reach the same level of health outcomes as might be expected for that. So if we could just be more effective around the world about how we utilize our money in healthcare, it would make a huge difference. So even if we do all of these,
the 4-minute warning, Sonia.
Thank you. Yes. So even if we do all of these, we will still not reach zero. And we would need to deepen all those actions. And what I wanted to do now is just to highlight some of the things that we would need to do on top of that. So one is that we would need to try and maximize telehealth. I'm sure that certainly across the UK, the transition through COVID from face-to-face appointments to telehealth happened, you know, with GPs offering appointments online within a week or two at a level that we would never have seen before. So the actual possibility of transformation at speed is quite doable when we really want to. It's not like we can't. So we can no doubt maximize the use of telehealth a lot more. The other one I wanted to highlight really is that we modeled as a sort of exploration what it would take or what carbon emissions it would reduce in the health sector if people stopped smoking, ate less meat, reduced the levels of obesity, and reduced air pollution. And what's fascinating there is that you can, it's a huge public health intervention, but it also is a serious climate intervention, because together those would contribute 1.8 gigatons of emission reductions in the health sector through reduced interventions. And that's the size of a big country like Japan and another smaller one. So it's not insignificant. And the other piece would be to also start looking at when we're doing green financing for recovery, for transitions in energy, is also to make sure that that is supporting some of these transitions and these wider transformations, so that our models of care are appropriate for going forward. The recommendations from this report really are multiple, and they reach out to national governments and what they can do, to the UN and global agencies, to the private sector and civil society. It calls on governments to create their own national roadmaps, action plans, regulations and legislation to decarbonize. And it calls on private health systems, suppliers and manufacturers to all join in the race to zero emissions. So if we move on to the next slide. it's all happening at a time where there's a lot of other action going on, and we're working with the COP26 presidency to try and make sure that different governments commit to a path, a decarbonisation, and to empower the health sector to measure, reduce and track emissions. So there'll be more in this space leading up to COP in Glasgow. And I think the next slide highlights the Race to Zero, which is where we're calling upon all sorts of organisations in the health sector to join this. It's really a great opportunity to join a UNFCCC platform. We're as Healthcare Without Harm, the official partner to that. We're going to be launching the first cohort of organisations at the end of May. And if we move on to the next slide, this is really my summary slide to say that this is all about transformational systems change. We need to be a societal leader to protect the planet, to protect people from climate change. If we get it right, we can have a healthier planet for healthier people, and vice versa. It's really a win-win. So I would like to call on you to all play your part. I'm definitely in to play my part, but it will require action from every one of us. And if you'd like to find out more, please have a look at the website. Thank you very much.
Thank you so much, Sonia, and thank you so much for all the work that went into developing this roadmap and showing us what we can, as a health sector, can do, and showing that we can get to zero emissions. Very much appreciated. Our next speaker is Dr. Debbie Wilson. Debbie is a Principal Sustainability Advisor in the Health Infrastructure Unit in the New Zealand Ministry of Health, and she'll be presenting on what the Carbon Neutral Government Program means for the New Zealand health sector. Debbie is a doubly qualified nurse and worked in the ICU for many years before moving into a sustainability manager's role in 2012 for a large district health board. Debbie established the Environmental Sustainability Program at the DHB, working closely with clinicians, and was in charge of measuring the first and subsequent organisational carbon footprints. She recently completed a doctoral program, and her research focus was sustainable healthcare practice, carbon measurement and reduction, sustainable waste management, and organisational change management. Debbie started working at the New Zealand Ministry of Health in March 2020 and has been developing guidance around sustainable design for healthcare infrastructure. Thanks, Debbie.
Kia ora. Thank you so much, Carol, and thank you, Sonia. That was a really inspiring presentation. What a great piece of work. I'm sure it's going to inspire many to transform. So I'm really delighted to be here, and thank you so much for inviting me. I'm just hoping that my cursor moves to the next slide. I'll press it, and if it doesn't soon, I may hand it over. Oh, there you go. Okay, so I'm just going to briefly present a really high-level overview of the health and disability services in New Zealand, for those of you who are not familiar, before launching into, again, pretty much a high-level overview of the Carbon Neutral Government Programme and present some implications for infrastructure and the wider health sector. I have to remember to press it earlier, I think. There you go. So we can all agree here, climate change is one of the greatest challenges of our time and presents us with many opportunities. New Zealand, through the Zero Carbon Act, has committed to taking urgent action on greenhouse gas mitigation and climate change adaptation. Here we go. I've pressed it twice, so I hope it doesn't jump ahead. So the health and disability services in New Zealand basically is a mixture of free and subsidised services. Public care is funded by general taxation, and basically the services and the care is delivered by a whole range of complex network of organisations and people. The government provides financial compensation for injuries, and this is for New Zealand residents, of course. Oops. So just to give you a flavour of the New Zealand population characteristics, I mean, it's a fantastic place to live in for most. It's a beautiful country, and absolutely blessed to be in a situation, unlike many others, to be, you know, actually able to go out and meet people. And so really, my heart goes out to all those people like Sonia and all the countries that are struggling with COVID at the moment. But you can expect a good life expectancy here, and you can see that we're, like other countries, got an increasing proportion of older people, 15% of the population and growing, and we've got a beautiful ethnic mix here. But we do have issues, health concerns, and of course these all delivering health in to complex comorbidities like this actually presents creates a high environmental impact. Our main health concerns, like many others, are cancer, mental health issues, and non-communicable diseases or lifestyle-related diseases, cardiovascular disease, obesity, and diabetes. We, like many other countries, work is underway to address inequities that exist across the healthcare system. And of course, climate change exacerbates existing inequities, as we are all aware. So what's the New Zealand government doing to tackle climate change? In 2019, the Zero Carbon Act came about. And as a result of that, there's been quite a flurry of activity and a range of policies that have come about. Also, our PM declared climate change emergency December 2020, and same day announced the Carbon Neutral Government Programme, or the CNGP, which is pretty much a roadmap for the public sector, and I'll go into that in a moment. So we've also established a Climate Change Commission, which is an independent advisor of expert group to independently advise the government on which climate actions to take. And that we had our first national climate change risk assessment released last year, which is a precursor to a national adaptation plan. There's also work underway on a health national adaptation plan in the early days of that. I'm just hoping to go to the next one. Yeah. So the Carbon Neutral Government Programme basically is really showing government leadership, because governments recognise that we need to reduce the emissions of our own activities. It demonstrates what's possible to other sectors in the economy, and it actually showcases positive action to the rest of the world. So what does it actually mean, the Carbon Neutral Government Programme? The overarching aim of the CNGP is to reduce government emissions at an accelerated rate and work towards carbon neutrality from 2025, 4 years from now. I have to acknowledge that this is very new, so there's still some decisions and mechanisms and policy settings that have yet to be formulated and decided on. So all organisations across the public sector, including the health sector, thank you, Carol, are going to need to annually measure, verify emissions and report on them, setting targets, putting in plans in place, and then actually offsetting the remaining emissions by 2025. How are they going to do that? Well, actually, they're going to work on, as long as my next slide comes in, here we go. They're going to focus on clean energy, phasing out coal boilers from the state sector and removing the largest and most active by the end of 2025. Going to also focus on sustainable transport, which actually heavily focusing in this instance on fleet and electrification of a fleet. After optimizing your fleet, of course, and rationalizing the numbers of cars required, and then optimizing the remaining. Also, as Sonia discussed, that buildings actually contribute a great deal of environmental load. So we're going to be implementing strengthened directions regarding the procurement of new government buildings, prioritizing low carbon designs, materials, and construction processes. So what about offsetting, I ask? Yeah, well, so we're actually inputting into a whole kind of, there's a cross-government party working on this to work on the feasibility and options and costs of this and what the implications this is going to have across the sector. But we're expecting that CNGP organisations will have to offset their emissions from 2025. Residual emissions, that is, of course. So the Health Infrastructure Unit, where I'm actually based, the implications this has on infrastructure, just to say, actually, we're working already with the Energy Efficiency Conservation Agency to switch hospitals from fossil fuels to clean renewable energy, bearing in mind that the New Zealand grid is currently around 80% renewable, and we're aiming to go to 90% renewable by 2025. So there's the backdrop. It's very different, I think, for a lot of other countries. And actually, if you look at the different pathways Sonia presented, we're probably focusing more heavily on pathway 1, especially on the facilities component, and by developing environmentally sustainable design guidance based on 3 foundational principles. And those are that hospitals will be high-performing, healing environments, climate smart, adaptable and resilient, not just to the climate, but actually adaptable to changing models of care, and generate wider health outcomes, which kind of cuts across those three pathways nicely. So the implications for the sector. Well, you'll be glad to know actually the public sector have been working for many years on measuring and managing down their footprints, and they've really done some amazing work. This is maybe out of date, this slide by now. I'm sure there's more that have actually set targets. Bearing in mind, as a result of the CNGP, all DHBs or district health boards, public hospitals, will be required to set targets against that aim. Now, if you look at what the health sector has actually been working on, this is my review, okay? So, you know, this is what I think. So actively pursuing clean energy over the years through the State Sector Decarbonisation Fund, actively working on waste reduction activities, and have been doing some amazing work in recycling, trying to reduce the waste generation at the start, and actually, you know, getting rid of single-use foam cups, for example, and promoting reusable coffee cups. And certainly some really good pieces of work on travel strategies and sustainable travel modes, not just the fleet, because of course the fleet is only one aspect of it. There's the whole kind of staff travel and visitor travel and access to public transport and cycling. So it goes much broader than the fleet. And in progress, I think across the sector, there's quite a lot of activity with different public hospitals getting into greening the buildings and the sustainable food systems, and also certainly looking at their models of care. And then I think opportunities, I mean, we've had a lot of active work on anaesthetic gases over the years, which is remarkable and been led by anaesthetists. But there are a lot of other opportunities with pharmaceuticals and shifting towards a circular economy and actually developing health adaptation plans to climate change. And this is my final slide coming up. Whew. So to summarise, the climate crisis is a health crisis, and health leaders have many opportunities to contribute to climate action. The CNGP focuses on decarbonisation and mitigation, and that pretty much equates a lot more to pathway 1. So we do have to work in parallel on pathways 2 and 3, whilst we adapt to the changing climate, and we do have to tackle inequity to protect the health of the people and the planet. Kia ora.
Fantastic. Thank you so much, Debbie. And thank you to everybody in New Zealand who's been driving sustainability and emissions reduction work over there for quite some time. And it's so amazing to see that the level of ambition that's possible when there's really strong and clear policy support from government for addressing climate change. So thank you for outlining that, Debbie. Next up is Cara Anderson from Unitingcare Queensland, who will present a snapshot of Unitingcare Queensland recently completed environmental sustainability strategy, which outlines how they'll shape a future that is green, healthy, just and resilient, and include a spotlight on their emissions reduction targets and plans. Cara is an Environmental Sustainability Project Officer at UCQ, who's leveraging her experience and relationships with facilities management to support the implementation of sustainability and climate resilience initiatives across UCQ's hospitals, aged care and community services. Her professional achievements to date include the successful rollout of energy and water conservation measures and recycling initiatives across the Blue Care portfolio. Cara is currently working on developing a heatwave outreach model to reduce the impacts of extreme heat events on vulnerable people in the community. Thank you very much, Cara.
Thank you, Carol. Welcome, everyone. I'm very delighted to be here. As Carol mentioned, I work as part of the Unitingcare Queensland Environmental Sustainability team, with my background predominantly in property and facilities, with mainly rolling out energy and waste initiatives with liaising with our aged care facilities. Slide. I would also like to add my acknowledgement of the traditional custodians of the land in which we live and work. Today I'm dialing in from Gubbi Gubbi country, which is in Redcliffe, north of Brisbane, Queensland. We recognise that Aboriginal and Torres Strait Islander people have contributed to conservation, climate action and management of lands and waters for over 60,000 years. And there's a potent opportunity for us to learn from, work with and celebrate Indigenous knowledge of caring for country. Who we are. Unitingcare is a non-for-profit provider of healthcare, aged care and community services with over 460 sites in Queensland and Northern Territory. We are better known by our service brands, which include the Wesley Hospital, St Andrew's War Memorial Hospital, Blue Care and Lifeline. As a service agency of the Uniting Church, we operate over 4 private hospitals, 56 aged care facilities, 10 Lifeline crisis call centres, 127 Lifeline op shops, plus many family and disability support services. A fun fact, we are the second largest employer in Queensland with over 17,000 employees and 9,000 volunteers. The primary drivers for Unitingcare Queensland sustainability endeavours are our mission. Environmental stewardship is one of Unitingcare Queensland's mission practices, and it's embedded into our DNA. With Uniting Church's statement to the nation, calling for the wise use of energy and resources to preserve for future generations. Health and well-being and justice. To improve health and well-being of individuals and communities, we must also preserve the healthy environment. Our clients are disproportionately impacted by climate change. Plus, it makes business sense. Environmental sustainability improvements are already saving Unitingcare Queensland more than $1 million per year. The status quo is changing, with more organisations are committing to strong action on climate change and environmental degradation. Staff and clients increasingly expect organisations to demonstrate environmental stewardship. Recently, Lifeline Retail changed to eco-friendly packaging in response to some customer feedback. On today's theme of decarbonising the health sector, I want to share some of Unitingcare's progress to date. Since 2017, we have reduced our carbon footprint by 9%. Some of this could be contributed to COVID. However, even prior to FY20, we have seen a strong year-on-year trend of decreasing electricity and fleet emissions, 2 of our largest emissions sources. We have installed solar on 21 sites, generating more than 550 megawatt of hours of renewable energy per year, gradually transforming our passenger fleet to smaller and more eco-friendly vehicles. 60% of our passenger fleet are now hybrid vehicles, avoiding over 1,000 tonne of greenhouse gases per year. We have conducted LED lighting retrofits at 50 of our sites since 2015 and installed air conditioning temperature control measures at 29 aged care facilities. In March, Unitingcare released its 2021 to 2025 Environmental Sustainability Strategy. This outlines 6 focus areas, each underpinned by tangible targets and action plans. Our 2025 targets include source 100% of electricity from renewable energy, reduce our carbon footprint by 70%, divert from landfill 30% of non-clinical waste, transition to 100% hybrid and electric passenger fleet, and include environmental sustainability criteria in 100% of procurement tenders to reduce upstream emissions and impacts. As I'm mindful of time, I don't want to talk to this slide in too much depth. However, I do think it's worth mentioning that the 2021 to 2025 Environmental Sustainability Strategy was a co-developed process over a 6-month timeframe with input from over 50 staff members, as well as external partners and service providers. One of our key targets is to reduce our carbon footprint by 70% by 2025. Electricity usage accounts for nearly 70% of Unitingcare Queensland's carbon footprint. So the single most effective action Unitingcare Queensland can take to reduce our climate impact is to shift our electricity usage away from fossil fuels over to renewable sources. But to live out our value of stewardship and reduce the CapEx and OpEx required for 100% renewable transition. Unitingcare Queensland is also focusing on reducing our demand for energy resources Our action plan includes continued rollout of energy efficiency measures, such as LED retrofits, building management system trainings and upgrades, as well as working with our property team to standardise some green building design principles into the design brief for new builds and major refurbishments. But when you look at our emission sources, it's clear that 100% renewable electricity commitment will do the heavy lifting towards achieving our 2025 emission reduction target. So Unitingcare Queensland's commitment to 100% renewable electricity by 2025 has two components. Firstly, self-generation, $3.8 million rooftop solar rollout targeting 4 to 5 megawatt generation capacity. This project will be rolled out across 25 aged care facilities and 1 hospital, targeting large sites on demand tariffs, which will deliver a better return on investment due to the reduced demand charges. And secondly, procured energy, reviewing all options available in the current energy market, such as purchase power agreements, direct contract with energy retailer, direct contract with renewable energy generator, and optimistic of achieving cost neutral or positive arrangement, but appetite is there for small increase. So lastly, I just would like to thank you all for your time this afternoon and allowing me to be part of this groundbreaking global roadmap for healthcare decarbonisation. What a privilege. And we also like to invite you to download a copy of Unitingcare Queensland's 2025 Environmental Sustainability Strategy by scanning the QR code above. I believe Carol will be sending a copy of this also with the other resources. And if you have if you'd like any further information or have any questions, feel free to contact the Unitingcare Environmental Sustainability team with the email provided. Thank you.
Thank you so much, Cara, and thank you to everyone at UCQ who's been involved in this strategy, and thank you also to the leadership at UCQ for setting these ambitious targets and having a really clear plan for how you'll get there. Really appreciated. Our next speaker is Glenn Pringle from IPC Health, and he'll be presenting on their innovative social prescribing program. So for this program, emissions reductions aren't a primary goal of the project, but has the potential to reduce emissions by providing effective primary care that reduces the need for more intensive health services and reduces the demands on the health system. Glenn is the General Manager of Innovation and Community Care at IPC Health at IPC Community Health in Wyndham, Victoria. He has worked in senior leadership roles in health since 2005 and has led numerous organisational change and transformation initiatives in that time. Glenn is passionate about inspiring and empowering people to make a difference, particularly where there's disadvantage or inequity, and is a strong believer in social innovation and social enterprise as a means of creating sustainable, impactful change. Thank you, Glenn.
Thanks very much, Carol. It's great to be here. Hello, everyone. I'd just like to start by acknowledging the Kulin Nation, who are the traditional owners and custodians of the land I'm on here in Melbourne's West, and pay respect to their elders past and present. I'd also like to acknowledge and welcome any Aboriginal or Torres Strait Islander people who are here today. As Carol mentioned, I'm talking today a little bit about social prescribing and health system effectiveness, so kind of a particular slice of decarbonisation. And I'll say it's a new concept for me to think of health system effectiveness in this light, but I found it really interesting to do so. So it's great to have that chance. Just waiting for the screen to tick over. Remy, would you mind advancing the slides for me? Thank you. So just to start with a little bit about IPC Health. I think, if I was going to say it really simply, I'd say what we're all about is reducing inequity and improving people's lives. And that's reflected really strongly in our purpose and values that you see here. We're all about making a difference for people, doing that in creative and innovative ways as well. So we work out of Melbourne's West in some of the fastest growing areas in Melbourne. So that's Melton, Wyndham, Brimbank and Hobsons Bay. It's an extremely diverse community with a lot of new arrivals and a lot of people with culturally and linguistically diverse backgrounds. And there's also a high degree of disadvantage in general compared to Melbourne and the rest of the state. So it's a really diverse and complex catchment area that we're working with. And in terms of the specifics of what we do, well, we offer the full range of health services. So from GPs and dental to allied health, mental health, alcohol and other drugs, child and family services, health promotion and community strengthening. So a really wide range. Looking at our service model. So our service model is adapted from social prescribing. For those of you who aren't familiar with social prescribing, I think one of the biggest places in the world doing that is the NHS in the UK. I think also Canada, it's being fairly widely adopted. And so I thought I'd take a look at the NHS website and see what they said. And they described social prescribing as a way for local agencies to refer people to a link worker, which we call a wellbeing coordinator. And that wellbeing coordinators give people time focusing on what matters to them and taking a holistic approach to their health and wellbeing. And so that means extending beyond just the medical and the mental health aspects right out into the social aspects of people's health and wellbeing. So for me, the key attributes of social prescribing are really about that easy access, the holistic approach, a client-centered and relationship focus, and also a goal-oriented approach that attempts to work with the client to understand what they actually need or what they're trying to achieve. It's probably worth pointing out that IPC Health service model covers the full biopsychosocial spectrum of care. So in some ways it's an extension of social prescribing, but it also shares all of those characteristics as well. Next slide, thanks. So I guess what's the connection here? How do we connect social prescribing with health system effectiveness and therefore hopefully with steps to decarbonise? So again, quoting from the roadmap, health system effectiveness talks about reducing emissions by improving system effectiveness, including eliminating inefficient and unnecessary practices, linking carbon reduction and quality of care, and bolstering resilience. So, you know, if we start with social prescribing and our service model, you have a client-centered, goal-oriented biopsychosocial approach with a prevention focus and multidisciplinary team care. The objective there is, in large part, to reduce isolation and increase people's connectedness and inclusion, increase their confidence and capacity to manage their own health, and therefore improve their quality of life more broadly. This also often results in a decrease in medication usage, decrease in GP visits, and also reduced time in hospital. Ultimately, that leads to not only a better client experience, but better health and system outcomes and reduced carbon emissions, I'm very happy to say. Next slide, thanks. So drilling down into that, I thought I'd talk you through a specific case study of an application of our service model, which is the Power Over Pain program. So this is a pilot application that's been running for about 6 months now. It's funded by our Victorian Department of Health. And it's been delivered in partnership with Western Health, who is probably the biggest provider of acute health services in Melbourne's West. This program was actually co-designed with people living with persistent pain and also co-designed with service providers from both Western Health and IPC Health and key stakeholders using our innovation framework. And it really aims to improve outcomes for people living with persistent pain. So you can see over on the left there, some of the key issues being faced in Melbourne's West around persistent pain. At the moment, there are over 400 pain-related ED presentations a month at Western Health. And then there's a wait list for services. And for non-urgent cases, that wait list results in a 2 to 3 year wait for services. And that wait time is growing in large part because of all of the issues experienced with COVID. And that exacerbates what is already a challenge, which is over-reliance on medication for people living with persistent pain. So you can see the journey map there that describes our approach. But I think really what it's all about and what we learned from working with people living with persistent pain was how important taking time to actually listen to people's stories and empathise with them was, and how important it was to work with them to make their pain smaller and their lives bigger, which is the kind of concept that a lot of the clients that we worked with talked about. And I think a social prescribing and our service model, they're both really well suited to that kind of approach. Next slide, thanks. Well, that's changed colour since I sent it in. Apologies for that glaring red, but I always really like to make these types of things real by talking about a client story. And so I thought I'd talk to you a little bit about the story of Olivia, who's a 70-year-old female. So Olivia wanted to increase her social and physical activity, but anxiety and depression were limiting her. And she was worried it was also affecting her relationships with her husband, who was also her carer. So Olivia enrolled in the Power Over Pain program, and she was assigned a multidisciplinary care team, which included a GP, a counsellor, a wellbeing coordinator, a pharmacist, and others. The team reviewed and started to reduce her medication use, working with her to address her fears of pain at the same time. And they also activated a personalised plan for her for sleep hygiene, which included a new routine and relaxation techniques. They helped Olivia re-engage with her exercise group. The group was also starting to move to online sessions, so the team also helped Olivia access and use the technology she needed to engage in those sessions. And they enrolled her in a remote tech education program that uses a phone coaching service to help people get to grips with new technology. So all of that happened over the course of a number of months, obviously. As a result, though, Olivia told us that she feels back in control again and that she's making great progress. Also, she's able to do the exercise now and has gained a lot of confidence as a result. And she's also built some great social connections, both for her and for her husband, and that's improved her relationship with her husband. And she also feels really supported by the service providers who are on the same page about her goals and the best way forward. And you can see that it also has helped really reduce Olivia's medication usage. And I guess the other thing I didn't mention also is that there are often representations to ED for people living with persistent pain, especially if they're on a waiting list, because it tends to just become too much for them from time to time. And so while we're not far enough into the program to start measuring it yet, we do hope to be able to measure a reduction in hospital visits as a result of this program as well. Next slide, thanks. So this is next steps for Power Over Pain. We're in phase 2 at the moment, which is the middle one there, which is about service expansion, but also crossing over into peer-led support groups. We're really keen on how it's transpiring that actually having people with lived experience working with the teams in delivering care is making a huge difference for clients. And so we're working on introducing that component into the program now through online and community peer-led support groups. We're also building out the website and introducing an evidence-based evaluation framework. And then in the next 12 months or so, hopefully expand to called communities. Sustainability, financial sustainability is important for us. So exploring fee-for-service models and partnerships. And hopefully with 12 months of evaluation and outcome measures, we'll publish and present findings. More broadly, the social prescribing program will hit about 1,500 clients by the end of this calendar year, which is really exciting for us and covers a lot of other areas, including mental health and child and family services. So I think that's a really nice example of how one way in which we can contribute to decarbonisation in the health system is in some ways just to do what we can to keep people out of it and to help them build capacity, confidence and capability in their own lives. And so that's the end of my presentation. Thank you very much, everyone.
Thank you, Glenn. So fantastic to hear. And it makes so much sense that I think sometimes when we think of sustainability and how to reduce the impacts of health systems, we go to further down the chain than where this project is operating, and we really need to shift our thinking. So thanks for highlighting a real life example of how that's working. Very much appreciated. We'll now move on to some questions, and thanks for all the questions that have come in so far. Feel free to send some more in. We won't actually have time to answer all of these questions, but instead what we'll do is we'll compile a list of questions and answer them offline, and then send the list of responses to everybody who's registered for this webinar, along with the recording when we send that out. So to start with, a question for Sonia. If for health services that are just starting to work on their climate mitigation agenda, do you have advice for what the key things they should focus on initially should be?
That's great. Thank you very much. Well, I guess it's always useful to get an understanding of what your carbon footprint is. And so starting by having a good measurement is really important. And I guess the challenge always in that is trying to do the measurement across all the different aspects of what it is that your hospital or your service covers. So making sure that it includes the things that are bought, as well the scope 3, as well as buildings and energy, as well as transport and travel. So where we've just heard the description of a service which is really home-based, that it will change quite a lot the carbon footprint of that service. So it's really important to do it across the whole piece. I think the next bit is to really look at where the opportunities are within your service or your hospital to get started. Spending a lot of time analysing data can stop you actually getting started, and there are so many different areas where you can get moving, and I guess engaging with your staff and with your community and is key, because actually that's where you might get the energy, the passion, and some of the best ideas from. So I would say start with a measurement and understanding of where you're at, start with where the energy is, and then develop a plan so that you can look at what you need to be doing. And the part of that plan would be trying to set a target. But don't spend 2 years setting a target. I would say just get anything you do to contribute to reductions will be useful. Yeah.
Thanks, Sonia. Next question is for Debbie. So Debbie, you started your career as a clinician. And so we're wondering if you had any advice for other clinicians that might be listening in about what they can do to advance sustainability at their health institution, and help advance the climate action agenda if they're struggling to find support. I'm wondering if you have any insights you could share, Debbie.
What a great question. And yeah, I mean, oh my gosh, the clinicians that I've worked with over the years that are so passionate about this and who've driven some amazing changes. It's remarkable, actually. I think it's actually can be quite frustrating if you haven't linked in with others. I think that's the first thing I do, is link in with like-minded individuals, whether it's in your department or other departments. Go and find out what other departments have done, what other areas have done, and then you can replicate that. Find out, ask your organization, your manager, what sustainability policy do we have? What's happening in this space? So just ask questions, always question. Think about the things that you use. It actually transgresses into every area of your life. Think about everything that you use at work. Question, do you need it? Just question everything and talk to your colleagues and peers and reach out. And I think also joining, obviously, a forum like Global Green Healthy Hospitals Network is absolutely a big beneficial first step as well. Because there's actually so much amazing resources out there, and you don't want to reinvent the wheel. We haven't got a lot of time here. We need to get cracking on with doing stuff. So yeah, go for it. That's what I say.
Thanks, Debbie, and thanks for the GGHH plug. And I'll send some information about GGHH in my follow-up email for anyone who's not aware of what it is. A question for Cara. In your plan, do you anticipate that the KPIs that you've got in there will cascade through to someone's personal performance and KPIs? So essentially asking, will executives be formally accountable?
Very good question. One would hope so. I would hope that we're leading by example. However, I will take that question as some homework and gather some concrete information and get back to you.
Fantastic. Perhaps we can let participants know along with the other questions. Thanks, Cara. And so I think Sonia's comment about what patients can do to bring about change has got a few people thinking, because there's a few questions on that. And so wondering, Sonia, I'll pose this question to you. If you're aware of examples or lessons on how to encourage patients and the public to demand the health services, or persuade the health services to be more sustainable, if there's any examples that we could refer to.
Thank you. Well, I guess I'm sure that there's lots of people on this Zoom call who will have had examples of where they've been a patient and they might have had an opportunity to ask their doctor or a health professional, ask a clinic what they're doing. I think we all think that it's not the sort of questions we can ask, and I think there's something about being empowered to do so. I do know that there are examples where patients with chronic diseases, be it diabetes or who use a lot of materials or dialysis, they often get concerned about the amount of plastic and waste that's generated from their condition. And I've heard some pleas from patients saying, please, health sector, I mean, the industry, can you try and find materials that are more apt and that we feel less bad about? And I think the patient voice in that is a very strong one, and we mustn't think that patients are disempowered. I mean, that's an old model of care. What's been spoken about today that Glenn was highlighting is actually trying to give power to patients for their own lives and for their own well-being. Also means that you can ask questions. And I think I would also like to empower doctors to say that they can actually talk to their patients about this kind of thing and whether it matters to them. The other example, which is not so much about patients, but it's just in Sweden, they've got a wise list for substituting of medicines, and it's available for patients to be able to have a conversation with doctors to say, actually, I would prefer this medicine because it's less impactful on the environment. And of course, social prescribing is even less impactful. So I think there's a lot of educating and reminding people what they can do. I had a cataract not so long ago, and I failed to ask why there were so many single-use drops and could it not be done differently? So I think there's an onus on all of us to use that role as well.
Thanks, Sonia. And Choosing Wisely is a program that we have here that I will also share more information about with everybody. And I know we're at time, but I'm going to sneakily slide in one more quick question for Glenn. I'm curious to know, are you aware of other social prescribing programs happening in Australia?
There's a couple. We haven't worked closely with them, but we've had a couple of conversations here and there. I know there's one up in Inala in Queensland that is moving along as well. And I believe there's one on the east side of Melbourne as well. I know that our social prescribing team has been in communication with them to exchange, questions and tips and techniques and stuff, but we haven't really worked with them extensively. And I'm not sure how advanced their programs are either. So they're the ones I'm aware of. I think it's fairly early days in Australia at the moment around social prescribing and social prescribing-based service models. But I do think the potential here, as far as I'm concerned, is absolutely enormous. I think the idea of considering the whole person and coming to understand the whole person and seeking to empower them to take ownership of their own health and almost act more as a facilitator of someone's health outcomes than someone who actually delivers health services, I think is really appealing to me. And even as a consumer of health services myself. And I think that it does carry significant holistic benefits and improved outcomes as a result. So, I'm really excited by where this is heading, and hopefully we'll have more and definitive results soon.
Awesome, thank you, Glenn. And so that will wrap up our question session for now. The additional questions, as I said, we'll provide a written response and share with everybody who's registered for the webinar. So thank you everybody for joining us today. Thank you also for all the work that is happening and that you're already undertaking to improve sustainability and reduce the health sector's contribution to the climate crisis. And thank you so much to each of our speakers for sharing your inspiring work with us. We appreciate it no end. Yeah, I'm really looking forward to seeing how we can use this roadmap to further scale up the ambition and work that is happening and action for decarbonisation across our health sector. So thanks for attending. Thanks again for everything you're doing and to reduce emissions, protect our planet and to protect our health. Thanks a lot.